Diagnostic testing for celiac disease. Establishing a diagnosis of celiac disease requires testing. These tests need to be performed while consuming a regular diet. These tests cannot be used if a patient is on a gluten-free diet. These tests would include laboratory tests, as well as samples of the small intestine taken during a procedure called an endoscopy. Standard laboratory tests, as well as the biopsies, measure the body's response to gluten. Therefore, testing cannot be performed on a gluten-free diet. This is important. The major laboratory test performed is a tissue transglutaminase IgA antibody. This is the most accurate test for celiac disease. This test can be inaccurate if a patient has a condition called IgA deficiency, which is seen in 2 to 3% of people with celiac disease. Some older tests would include endomysial antibodies and gliadin antibodies, which are not as accurate. These tests should not be used as an initial screening for celiac disease. In some cases, such as a case of IgA deficiency, they may be useful at the discretion of the doctor. Tests on the stool or tests on the saliva have not been validated in the diagnosis of celiac disease. I do see a number of holistic doctors using these tests. These tests have not been validated for a diagnosis of celiac disease and should not be used. As celiac disease is a disease of the small intestine, the most accurate way to see if a patient has celiac disease is to actually take a biopsy or sample of the small intestine. A biopsy enables the doctor to assess the degree of damage to the intestines. It is considered the gold standard for diagnosis. In order to make an adequate diagnosis of celiac disease, your doctor should take 6 samples of the small intestine to make an accurate diagnosis. In people who have been tested in the past, this is an important question to ask. This is an example of pictures from an endoscopy. The 3 photographs demonstrate that the small intestine has been degraded. In the bottom left, you can see the cobblestone road appearance to the small intestine. The image on the bottom right is a biopsy sample showing inflammation of the small intestine as well as loss of the villi, which are the finger-like projections of the small intestine that aid in food absorption and become degraded in cases of celiac disease. Standard testing for celiac disease requires exposure to gluten. If a patient is not consuming gluten, the tests are inaccurate. The usual labs and biopsies are measuring the body's reaction to gluten. If a patient is already on a gluten-free diet, a gluten challenge may be considered for testing. This would require eating 3 grams of gluten a day for 4 to 6 weeks. This is the equivalent of 1 piece of bread. If someone cannot stop the gluten-free diet, there is a genetic test called HLA typing. Our genetics are the same no matter what we are eating. HLA typing can be useful if someone is unable to stop a gluten-free diet to pursue testing. HLA. HLA stands for human leukocyte antigen. HLA is a genetic code for the coding of somebody's white blood cells. These are specific proteins that are unique to each individual that line the white blood cells. There are many different types of HLA on human white blood cells. All patients with celiac disease have a type of HLA called HLA-DQ2 or HLA-DQ8. These HLA types are required to have the autoimmune response to have celiac disease. Since all patients with celiac disease have these HLA types, a negative test for HLA-DQ2 or DQ8 means that it is impossible for that person to have celiac disease. If the test is positive, it does not necessarily mean anything. It simply means that the immune system is wired to have the possibility of having a celiac autoimmune response. This is because 25 to 30% of people have HLA-DQ2 or HLA-DQ8. Thank you for your attention on this summary of testing for celiac disease. For more information, please visit my blog.